we should be good for this, that you're not going to miss any of this crucial information. So we'll go ahead and get started. I am Dr. Megan Graff with Movement RX. I'm so excited to bring this topic to you because I know it is one that applies to everybody at some point in your life and exercise career. Hello to those of you on Instagram. You guys are over here. I'm going to be looking this way, but I know you're there. I haven't forgotten you. I'll be trying to pay attention to questions as they come in. I will address them towards the end. So if I say something that you have a question about, just go ahead and put it in the chat box. And there's Pear logging on, hogging the screen. Just couldn't get enough of the attention on this side. So then he goes to behind his computer and takes it. No. So be sure to either in the Q&A box or in the chat box, go ahead and submit any questions. Or for those of you on YouTube, be sure to put those in the chat box. I have that up as well that I can take a look at the end. So today we're going to be talking about, should you exercise through pain? How do you know when you can push through that? Should you push through that? And finding that balance between getting back to what you want to do, but making sure that you're not causing further injury or causing injury in the first place. So we are going to start talking about why does this even matter? Well, like I said, it's relevant to everybody. At some point, you're going to develop pain. It is a normal part of life to some degree. Doing something that your body wasn't happy with, it is going to let you know. And things happen, whether you go for a long hike and your body wasn't used to that. And so maybe you get a little bit of nagging knee pain, you rest it, it goes away usually. Or you help a friend move and you're moving heavy boxes and things like that, that all of a sudden you are doing something that your body is not used to, and it's going to potentially create pain because it's a lot of stimulus all of a sudden that your body wasn't necessarily prepared for. So it's not uncommon for things to pop up here and there, but it's, does your body have the time to recover, that you're able to get back to normal activities and it doesn't become this recurrent injury basically, or does it then create this nagging pain? So we'll talk a little bit about how or why it goes one way or the other, and then what you can do to try to prevent an injury from becoming a chronic thing. But acute injuries, they're going to happen. It's a part of life, but it's what we do with that pain that develops from an injury that matters, and how to progress back both from injury, and then maybe you had an injury many years ago and you've dealt with this pain off and on. That's the other common thing I'll see, that somebody injured their back 10 years ago, and periodically they'll have issues that it feels like it takes them out from being able to do what they want to do. So how do you know when you can push through that to get back to being active versus needing to back off to let your body recover? So one, exercise is a really important part of recovery and getting out of pain. But, sometimes it can be really scary if it, say you hurt your back deadlifting, and now you're afraid to bend over to pick anything up, or especially to do weighted deadlifts in the gym. That's very common. So, we tend to stay away from some of these movements, but ultimately, those are the movements that are going to help get your body stronger and make it more resilient. But how do you progress to being able to do that without it creating that pain? So ultimately finding some kind of exercise, and especially cardiovascular exercise, is helpful when recovering from injury. So even if you're primarily a strength athlete, say you hurt your shoulder doing something, whether it's going for jogs or getting on the rower, something that doesn't aggravate the pain that you have, but gets your heart rate up. Maybe that's even just going for a walk through a hilly neighborhood, enough that you feel like, okay, I'm breathing a little bit heavier, my heart rate is up. These are the things that ultimately help with healing and recovery, because bringing good blood flow to the area is going to help with that. So exercise is really, really important, and finding that balance of what can I do and I'm not aggravating the pain. That's the most important piece is balance. Like I've talked about in the last couple of webinars that you can check out on our YouTube channel to see what I'm talking about. It's that balance of stress to the body with giving it time to recover. And it's the same thing when you're trying to work through pain. So, you know, pain while you're exercising obviously is not a normal response of the body, but sometimes our body creates this chronic pain, and that doesn't necessarily mean that you're causing damage to the tissue. So normally, you know, with tissue injury, your body lets you know, hey, something's not right, and it creates pain. But sometimes that just becomes a warning signal. Your body learned, hey, last time we did deadlifts, that hurt the back pretty bad. So I'm going to let you know that we shouldn't be doing deadlifts. So I'm going to go ahead and create a little bit of pain as a warning signal to basically make you not do it, to try to protect your back. So it becomes this maladaptive mechanism. Your body is doing it to try to protect you, but it's sending these signals in the absence of any tissue damage. So your body is creating pain, even though there's nothing wrong with the movement. You're not doing any damage to the body. So when our pain gets to that point, it's a matter of you have to push through that to retrain your body that it's okay to move and it's not going to create injury. Of course, that doesn't mean like, okay, ignore the pain and go max out your deadlift. That's not a great idea because one, if you push through it too much, it's just going to set it off and cause it to hurt more. So it's always a balancing act, both with the stress that you apply and then how you allow your body to recover after the workout. So we'll get more in depth on this, but you know, the main question is it okay to have pain and still exercise? Yes, it is. But knowing what to do and when to stop is the important piece of that. So if you have pain when you're exercising, you know, say you get knee pain and you want to get back to running. And so you go for a jog and you get, well, let's say 2 or 3 out of 10 pain in your knee. And this goes for the same of if you get shoulder pain with pressing overhead, you know, make a note of the degree of discomfort that you're feeling and give it either a few repetitions or a couple minutes. You know, if it's something like running, give it a few minutes, or if it's something for repetitions, give it a few reps and see how that pain behaves. Meaning, does it get better the more reps that you do or the longer that you're jogging, or does it get worse? And then sometimes it's just, well, it kind of stays the same. So those are kind of the keys of paying attention to that, of knowing, is it okay to push through that or not? So if your pain is getting better or staying the same the longer you're doing something or the more reps of something that you're doing, then keep going. Because that's, again, kind of that warning signal that your body's saying, hey, I don't know if this is okay. I'm going to let you know I don't think it's okay. So give it a little bit, and your pain should stay the same or get a little bit better. When it is a maladaptive thing, or you truly are potentially causing some harm to a tissue in the body, then typically that pain is going to get worse. So you might notice, okay, I'm starting out, it's a 2 or 3 out of 10 pain. You know, I give it a couple minutes of jogging and actually it's starting to creep up. It's like a 4, okay, now it's a 5. That's your body's way of telling you you need to back off. So that's, you know, the kind of quick and dirty way to assess, is this pain okay or not? Is what is it doing while you're doing the activity? Is it getting better, worse, or staying the same? So better, staying the same, keep pushing through a little bit. And then if it's getting worse, definitely back off. And we'll kind of talk about the nuances of that as well. But the next step of that is, okay, how do I feel an hour after I stop the activity? And how do I feel the next morning? Because sometimes, depending on the pain or the injury that you have, the discomfort doesn't come on till later in the day or until the next morning. So if that's the case, then, give your body that time, see how you respond. So it's really the overarching theme is being more mindful as you exercise and how your body is responding to that exercise. So it's not common like, oh, actually, I was able to jog for 5 minutes and then I walked the rest of the time, but man, my knee was really aching later in the day more than it usually does. So again, that's a good indication that you need to back off. That's not to say stop running. It's you need to find that threshold of what's okay for your body. So next time you go to lift, and let's say you did 20 reps of whatever lighter weight with an overhead press, and it felt okay during, but then your shoulder was aching a bit afterwards, then next time try half the reps or half the weight. And it's always this, it is a little bit of trial and error to see what feels okay for your body and what you're going to be able to recover from. And then from there, potentially in the next session or a few sessions, getting your body used to that, then building up a little bit. So it tends to be one, we need to progress way slower than maybe we want to, especially if you're trying to build up for any kind of a competition. We see, oh, I need to be at this point in the schedule, and your body doesn't care what your plans are for a competition. It knows, it just knows tissue healing and stress balance, and your body can only adapt so fast to the stress that you apply to it. So it's always this balancing act of you have to push it, you have to do those exercises a little bit more to get your body stronger. But if it's beyond your body's ability to adapt or your tolerance to that stress to the body, it's going to let you know that it was too much. So listening to that and giving yourself more days to recover. Next time you're trying the exercise, going lighter or doing less, it's, that's going to help you find that sweet spot or your kind of entry point into exercise that's really important. And that's the biggest key is listening to that and knowing how to push that of just, okay, I've got to start way lower than maybe I feel like I want to because I'm used to performing at a really high level. But, I know for me, earlier in the year, I was dealing with a running injury. I was having some pain going into a marathon. I knew the marathon was going to hurt, but I also knew I was at the point like I could get through it. I was going to be done with training for a while after that. So I was like, I'm just going to do it and then I'll deal with the repercussions after the fact. And sure enough, I was hurting a lot more after that race. And it was frustrating because, I wanted to be back to, I should be okay to run 3 to 5 miles. Why can't I do that? And even I was being kind of impatient and trying to push it. So then I had to back way off and I would jog for 30 seconds and then walk for 5 minutes. And I just had to keep playing with that and finding that balance of what is my body going to actually let me do without increasing the pain. And early on, it was not a lot. And that's what we need to come to terms with of you can't rush it and you should back way off before building back up. So just really, really listen to your body and know when to stop. So not only during exercise, monitoring your response, see how you feel an hour to 2 hours after exercise. Again, you might feel a little bit of soreness or discomfort, but it should just be more of that, wow, I haven't been able to do that in a while, or I can tell I worked some muscles, but not an increase in that pain that has been limiting you. And same thing the next morning. You shouldn't have increased stiffness or pain the next morning. And that's, keep in mind, there's a difference between, as you're building up with your exercise, you're going to have stiffness more in the, wow, my muscles are sore, I got a good workout kind of way versus, okay, something feels sketchy. This is that same like pain or injury I've been dealing with, and it's feeling a little increased the next morning. That's when you need to take another rest day or two and just monitoring how your body is responding to this new stress you're trying to apply to it in a good way. Exercise is a good stress, when done in proper balance with recovery, sleep recovery, like we kind of talked about last time. So obviously that's not to say, manage your own injury. If something is obviously wrong, you should go see your health professional. Knowing when to do that it's tough to say just because some people, push through pain for a long time before they finally go see somebody. I would say, as a general rule of thumb, if you develop a new pain that didn't come on after any specific input, like I mentioned at the very beginning of, I helped my friend move, now my back is sore for a couple of days, it should subside. Obviously, if you do something, whether it's in a workout or you misstep and you hurt your ankle, if after a couple of days it's not improving, then I would say go see your health professional, whether that's your doctor, physical therapy, family doctor, just getting it checked out, getting it cleared to get back to exercise. Make sure you are in the clear for that. Obviously, if anything feels sketchy, if you're developing a new pain that you don't feel like has any reason to be there, definitely see your health professional. It's use common sense when it comes to that. Don't try to just push through and work through that on your own. Even if it's an acute injury, obviously, if it's to the point where, oh, I did something with my shoulder and I can't move it, that's pretty extreme. So again, go get it checked out. So once you get cleared by your health professional to get back to exercise, I would say still working with somebody, so a doctor of physical therapy or other trusted provider that can help guide you in your journey back. But understanding the principles that are important for yourself are crucial in getting back to exercising. Because I know sometimes, whether it's a medical professional or a coach, either are going to want to be more conservative, or maybe they want to push too hard. And so for you to understand how to be listening to your body, so you can help that input with balance to, getting back to the level that you want to be at, having that general awareness for yourself is really important. So just as a note, obviously work with your professionals, but it's something that you want to be educated on for yourself. And that's a big part of what this webinar is for, is helping you understand a very basic understanding of kind of why pain develops, why injury happens, and how to use your body's feedback, that discomfort that you may get during exercise, and how to navigate that and getting back to that higher level that you want to be at. And just knowing to get back to that higher level of exercise, it may need to be a lot slower than you expect. I feel like 2020 is a great year to work on any nagging pain that you have been dealing with over the years, because everything's canceled. So it's a perfect time to work on form during exercises, whether that's with your running, your lifts, things that we have been putting off for a long time because we've always been building up and trying to push through, like, oh yeah, I get shoulder pain if I do a lot of snatches, but it's not enough to make me stop, or I back off for a couple days and then I can do a bunch of snatches again and then I have to stop for a couple days. So I think a lot of times people do this kind of back and forth dance with pain, but it's kind of always there, and it's just a matter of time before potentially an injury happens and takes you out of your training for a longer term. So taking advantage of the time that we have now to address mechanics to help offload tissue. So, pain and injury a lot of times can happen because a tissue is getting overloaded for one reason or another, whether it's mechanics or just volume of exercise. And then, your body's ability to adapt to that stress that you're putting on. So, say you're squatting heavy for a week or for a month, if you're doing kind of a block that way, and you were able to do that a few months ago, no problem. You're doing the same kind of cycle now, but because of COVID, maybe you're more stressed, you're not sleeping as well, you're eating like crap, and all of a sudden you're getting these nagging pains that you didn't get when you were squatting like this a few months ago. Well, it's not only the load that you're putting on your body, it's your body's ability to adapt to that load. So keeping that in mind too, of those other lifestyle factors that are really important in your body's ability to adapt, and how your body responds to exercise in that pain response that we were talking about earlier. If you're really stressed out, that is going to make your body, a little more on high alert when it comes to that pain potentially coming on during exercise. If you're real zen, you're in a really good mood and you go for a lift, like that can make a difference in how your back is feeling when you're lifting versus if you go into a training session and you're really anxious about all these different things, you didn't sleep well, and you have all these other things on your mind that have your system kind of ramped up. That automatically is going to ramp up your nervous system a little bit and potentially make you more sensitive to feeling pain during the workout. So having that balance between recovery, down regulation, so like we've talked about previously in other webinars of the importance of that down regulation and nice deep breaths, whether it's meditation or mindfulness practice, or just having some time at the end of the day or the end of your training session to kind of reset and spend a couple minutes doing some deep breathing. That is really important in your body's ability to adapt for pain as well. So I want you guys to go ahead, and if you have any questions about either pain that you're dealing with specifically, that you have any questions about, or anything I've talked about, go ahead and start submitting those questions in the chat, and we'll kind of talk through some of the question and answers. So another topic that we'll kind of touch on in a question that I got is the importance of potentially a gentle strength program for supporting muscles or the musculature while in pain. So being able to progress back to activity, say because you've been dealing with pain for a long time, you've stopped any semblance of a previous exercise program you've had, and you're just kind of making it by day, and your fitness has kind of gone by the wayside, or maybe fitness has just gone by the wayside because of quarantine and not having access and those kinds of things, and it's hard to get back into it. Maybe you got back to going to the gym when here in California, when they opened back up for a short period, they're somewhat closed back down. Some were able to stay back open, but sometimes getting back into that programming, it's all of a sudden like, I didn't have pain when I was trying to do this pre-quarantine. Why am I having such a hard time getting back into it? It's a matter of kind of respecting that time you took off, respecting where your body is at if you're coming back from injury. And kind of like I talked about with cardiovascular exercise, having a gentle strength routine is really important for easing back into that practice, whether it was already a part of your program or your weekly training anyway, or it's something that you want to get into or want to get back into. That's a really important way to progress back to potentially even a higher level of fitness that you were at, or maybe you're not as familiar with having strength training as a part of your week. If you're just a runner and you're not necessarily doing strength training, or you go for walks and that's kind of your weekly fitness. I stand by, I think it's very important for everybody as a well-rounded human being to have some degree of a flexibility practice or mobility practice each week, some kind of strength and some kind of cardio. And that can look different for everybody, but having, working on those different aspects are really important for keeping your body healthy, cardiovascularly, working on strength, and then of course kind of the mobility you need to be able to do all those things in daily activity. So a gentle strength program also helps in life. Even if you've kind of gotten out of a fitness routine, having that helps prepare you for those times that you are you need to bring in a bunch of boxes. Say you're doing home renovations and there's a lot of stuff you're having to carry around the house that are maybe heavier than usual, or you go home once you're able to visit other family and get to hang out with the grandkids, and there's like a lot of bending and lifting and things like that. It's not just about strength programs in the gym or doing CrossFit. Don't get me wrong, I love CrossFit, but training for life is important. Being able to go through a well-balanced strength program to help you feel comfortable and confident, potentially with those movements and activities that have been problematic in the past, is huge. So, having a well-balanced program that addresses some of those mobility restrictions that prevent you from getting into a good position to be able to bend over to properly lift something from the ground, but also has that balance of working on strength and proper muscle activation to be able to do that and use or maximize using the right muscles, is really important. And we're very fortunate to have those programs available online, and you have access to us weekly. So myself and our coaching professionals that help you with your movement, as well as kind of talking you through similar kinds of topics of this. Yes, we have these webinars available, but we also have Q&A sessions for our members to be able to ask questions if you are struggling with a particular movement in the program, or maybe it's a movement in daily life and you want to know what to be focusing on with your programming and how we can, make it a little more personal to you and how you can adapt the programs to follow to help you, feel your best, achieve your goals, maximize your function. Our programs are there to help. And what makes it a step above a lot of other online programs is you have access to us. It's not just this set it and forget it, follow the program, good luck with everything. Every week you have access to us. So if you have questions about the program, how to specifically adapt it for you, we're available to help you get the most out of those programs. And having that well-rounded kind of strength and mobility routine is huge when it comes to, again, getting back potentially to a higher level of activity if you feel like injury has set you back a little bit, or maybe you haven't been as healthy as you feel like you could be, and you want to start moving better and feeling better because just in general things hurt. You don't feel strong. Overall, you don't feel well. Our programs help with that, and there's so much available to our members of different challenges. So helping you get a better understanding of nutrition, mindfulness, and meditation. We have all facets of health and wellness. So yes, I love talking about strength and mobility. That's kind of my bread and butter as a physical therapist. But if there's anything I've come to realize more and more over the years is we can't just look at your shoulder if you're having shoulder pain. Yes, we have a shoulder fix program, which is great and really helps strengthen the upper body and help with imbalances in the shoulders. But just because you're getting shoulder pain, that doesn't mean that's where the problem is. There's usually a lot of other things that go into it, as far as, upper back stiffness, potentially your hips and ankles are stiff, and it's affecting the way that you move in your workouts. And so working on that head to toe mobility and strength, as well as addressing some of those other pieces like your body's ability to recover, that down regulation piece. So that's where the mindfulness and meditation comes in a little bit, monitoring how your body is feeling and responding to the exercises, and thinking about, nutrition on a weekly basis and how that plays into how you're feeling and how you're recovering. So be sure to check out our website, movement-rx.com, to learn more about our different programs. You have access to potentially 80 plus weeks of programming, between different programs that are focused on different body parts. We have different challenges available to you. And like I said, you have weekly access to us, as well as discounts on one-on-one sessions. So check out the different tiers. There's all different levels, no matter where you're at. I think there's a great option for everyone, no matter what you're looking for. But if you have any other questions about our program, how to get set up with that, or doing a one-on-one session with us to learn more, and potentially address an issue that you have specifically, that you want to get help with, that maybe you've been putting off. Like I said, 2020 is the time to get at those things, so that way we can hit 2021 even harder. I think we all have this like magical idea that 2021 is automatically like, okay, January 1, COVID's gone, things are good. I know, as much as we would love that to be the truth, we don't know how much longer we're going to be living in this kind of new normal. So, use this time that you have, where it's kind of an indefinite change in the way that we're living life to, get at those things, reevaluate your goals, create new goals of, I've been dealing with this pain off and on for years. Let me take a step back from my intense training that I've been doing. And I want to do this program that's focused on getting my shoulder better or getting my back better, and helping you understand moving mindfully and paying attention to how you're moving well, and ultimately being able to come back that much stronger when things are getting back to normal and you're ramping up training potentially for a competition, or just once you're able to get back into a gym and maybe go a little harder, heavier than you are able to do during quarantine. So email us at wellness@movement-rx if you have any questions. And like I said, check us out on our website and see the different membership options that we have, because I think you will get a ton out of it. Thank you so much for joining me. I'll stay on for another minute or so because I've had just giving you time. If you have any last wrap-up questions, I will answer those. But thank you again for joining us. Next week, we will be talking about nutrition. So be sure to check that out because we are going to be launching our nutrition challenge. And, again, I love seeing these different programs that we have rolling out available to all of you, because there are, they're chocked full of great information, and you're getting something different each day of the week. And it's fun to break up your normal workday with these short, quick, fun little videos of something to think about throughout the day. So be sure to check that out. We will see you next week. Thanks again, everybody. Have a great weekend. I know it's almost the weekend. Thanks, everyone.